Hi, I'm Dr. Scott Mosser. I'm a board-certified plastic surgeon and gender surgeon in San Francisco, California, and I perform a lot of chest and body contouring procedures for gender confirmation. Today we're going to talk about two procedures which are very similar, and they're the inverted T and the buttonhole procedures, both of which are under the category of what's called the inferior pedicle procedures. In fact, the only real difference between them is that the inverted T has a final result with a vertical scar that runs down from the areola to the lower incision. There's a lot of buzz about these surgeries, and so there's more to explain here before we begin the video. These procedures provide a hope of having nipple sensitivity that's better than what the double incision procedure can provide. And though this hope is true in some cases, it certainly is not a guarantee. It's really important for you to consider the pros and cons of this procedure, and to learn more about that, please click on the link that's on your screen. In particular, things to consider are whether you're seeking as much flatness as possible to the chest, whether a full customized location of the areola is important to you, and whether you're hoping to develop a more muscular chest later on after surgery. In all of these respects, the double incision is a more powerful tool for us to use. With regards to sensation, it's important to note that the double incision procedure does maintain sensation to the nipples the vast majority of the time. However, this is a normal level of skin sensation, like what would be present in the rest of the chest. If you were to scratch the upper part of your chest, that's more or less the sensation that will be present in the nipples after a double incision procedure is healed. For people that wish to try to preserve hypersensation, which is also called erotic sensation of the nipples, but who have to have a lot of skin removed, the buttonhole or inverted T procedures might be able to achieve this. The reason is that there's a great deal of redundant supply of the sensation of the areolas from nerves that come from all sides. Some of them reside just beneath the skin and come upwards from below. The hope is that if we can maintain a small amount of tissue just beneath the skin running all the way up to the nipple, then maybe some of the nerves that will remain in that tissue will still supply sensation to the areola. These nerves are too tiny for the surgeon to see during surgery, so the patient and surgeon have to wait for weeks to months after the procedure in order to know how much sensation has actually been maintained. So now let's get started with showing you how this procedure is done. Much like the double incision procedure, the skin is marked to determine how much needs to be removed and exactly where the final incision lines should be located, as much as possible. However, the lower incision has to be at the lowest part of the breast, so the surgeon does not have as much discretion with regards to where the final scar will be located. The areola is marked to be the proper male size at the conclusion of the procedure, and there's another marking that comes up from below and extends just over the areola and back down again. This marks the lower tissue that will remain behind, which we call the inferior pedicle. However, we cannot keep the skin on the surface of this tissue because it will be covered by other tissue. So very carefully and very delicately, the surgeon removes just the external bit of skin on this pedicle, and this process is called de-epithelialization. Next, this pedicle is lifted off the rest of the tissue and is quite thin. On the one hand, a thicker pedicle might result in more sensitivity to the nipple from more captured nerves. On the other hand, the thinner the pedicle, the less tissue is left behind, and therefore the flatter the chest would overall appear. Once the pedicle is delicately developed, the rest of that tissue is removed, very similarly to the way that is removed in the double incision procedure. Extreme care is taken to create a smooth and uniform result that is symmetrical between the two sides. This is where the buttonhole and inverted T procedures are slightly different. When the upper edge of skin is not too stretched out, the buttonhole technique is used, and in the buttonhole, the two sides of the skin are simply closed and sutured together. Then a small hole is made in the skin that's the exact same size of the measured areola, and that small hole of skin is removed. The areola that's hiding beneath the skin is then brought out through this hole and secured in place with tiny stitches around the edge. On the other hand, when there's a lot of excess stretched skin in the upper part of the chest, some of that skin may need to be removed. And in that case, a bit of excess skin in the center part of this flap is removed as you see here. And then the pedicle is placed into this location and the incisions are closed in a similar way. For both the buttonhole and inverted T, a drain is sometimes placed, which remains in place for about 5 to 7 days, and is then removed painlessly in the office. Once the chest is healed and the swelling has come down many months after surgery, it's common for patients to get a very pleasing degree of flatness. Sometimes, if they started with a great deal of tissue before surgery, they will have an appearance that looks a bit more like a male chest in which somebody has a fair amount of weight on their body and chest. It won't be quite as flat as the double incision procedure. Again, the goal that we're solving for with these procedures is the hope of maintaining hypersensation of the nipple. Not being able to have an optimal chest flatness is a known trade-off of both the buttonhole and the inverted T. So those are the basics. As you can tell, this is a bit more complex of a surgery than some of the others that we have described. And therefore, when you're deciding between procedure types, it's a really important idea to discuss these options with the surgeon that performs all the different procedure types so they can guide you through the best decision for you and your set of priorities. For more information on this or any of the other procedures that are available, please click on the link. And to take a look at more videos in this library, please click on the box in the upper right corner of the screen. Thanks for hanging in there, with this one being a little bit more extensive than the other videos. And feel free to reach out to us for a consultation anytime.